Hi there everyone, welcome back to the Qualicare Family Home Care YouTube channel. My name is Trevor. This is Teresa Craig and she is the franchisee owner of the Qualicare franchise out in Edmonton East, Fort Saskatchewan and Sherwood Park areas. And today we're going to be talking about elderly dehydration. So dehydration in elders.
Yeah.
Quote from Thomas Edison. The doctor of the future will no longer treat the human frame with drugs, but will cure and prevent disease with nutrition. Mm-hmm. That is pretty interesting. I don't know if we're going to do it because it seems like our nutrition is getting worse than it was back when Thomas Edison was around, because it was more, agrarian or, more of the agriculture type of thing. We had more natural foods, and now we're just eating who knows what. Yeah. And I got a quick statistical fact for you guys. In one study of residents in long-term care facility, it was reported that 31% of patients were dehydrated. And in a related study, researchers found that 48% of older adults admitted into hospitals after treatment at emergency departments actually had signs of dehydration. So tell me, Teresa, a little bit about your history with dehydration and just get us going with this topic.
Well, first of all, dehydration is lack of water in our bodies. So that happens when the body doesn't have the amount of water that it needs. And it needs water to regulate the body temperature, regulate the body systems, for all the organs to work properly. We need water. Water is very essential to living. Older individuals, the elderly, they really do run the risk of dehydration because, here's an interesting fact, as we grow older, our thirst decreases. So even if our body is saying, hey, I need some more water, we can't really count on our thirst because as we get older, it decreases. So not always will tell us that we need water for our bodies.
That's interesting.
Yeah.
I never knew that.
I didn't either.
That is something that I've heard it here first, folks.
Yeah.
I was this many years old when I found out that as we get older, our thirst decreases. Yeah. So tell me a little bit about what are the signs of dehydration in the elderly? Seeing as they can't tell themselves, right. How do we do it?
We can look at somebody and we can look for sunken eyes. Their skin is kind of loose, and it's really not. It doesn't have a good feel to it either. Okay. It's quite dry. A lot of times they lose weight as well. They don't go to the washroom as often, and when they do, sometimes it starts to get painful. That may indicate a UTI or a bladder infection. Okay. So important things to really watch out for. They might complain of muscle cramping too. That is indicative of dehydration. This also indicates a lot of other things, but that's usually the one you would look at first. Also too, they may become confused because the brain also needs that water to function. So if someone with dementia is actually worse and you see that they're even more confused than before and it was a sudden start to it, it could be dehydration. So those are some of the things that we look for.
So Teresa, can you tell me what different reasons are there that seniors have when it comes to being dehydrated?
Well, as we know, when we get sick, like with the flu, we get a fever. Oftentimes we sweat or we vomit because we're sick to our stomach. Fever also, our body heats up with fever. That can also use up the water in our body as well. So those are some of the things that can cause dehydration. If it's a really hot day and you're not drinking enough water, and like I say, the thirst decreases as you get older, so oftentimes the elderly won't drink enough water during those hot summer days. That can also trigger dehydration to a more severe kind of extent. Also to medications that we take. So there are a number of medications people take for heart disease, for a buildup in water in our body, high blood pressure. We often take medications for that actually make us lose water. So you need to replenish what you've lost. So in addition to that, the medications that we take will also decrease the water too. So it's important that we watch for that. Knowing the kinds of pills that your loved one takes is important, just to see that is there a medication that my dad takes that'll make me be concerned about dehydration.
Right. Okay.
Yeah.
There's a lot of different things that can dehydrate us, especially when you're elderly and you're not drinking enough water.
Yeah.
So it seems like you've got a lot of things against you trying to stay hydrated.
Yeah. Right? Yeah. And a lot of elderly folks, because of the medications they take or just because of their bodies, they oftentimes get constipated. So relief will come with laxatives. Well, laxatives absorb the water in the body. And so that takes away from the water that the body needs to be, functioning properly.
Oh my goodness.
So again, there's something else that could cause dehydration as well.
All kinds of things I'm learning about dehydration today.
Yeah.
So what can families do to help alleviate these conditions?
Well, I know that with our clients, oftentimes what will happen is I'll get the complaint from the family members that, mom and dad, they're not drinking very much and I really have to push the fluids. Well, yeah, exactly. Remind them, say, hey, why don't we have a drink of water? If they don't like water, you can use other sources. You can use, fruit juice without added sugar. Sometimes soda water is a little different, and if you add some lemon to that or a lime or whatever, they enjoy that a lot more too. So just reminding, pushing the fluids. They should have up to 8 glasses a day, although that might not be doable with somebody who's elderly.
Right.
So even if they get 4 glasses a day, something better than nothing.
Right.
Is and if you have any causes of concern, then it's a great time to call your family doctor and take them in to get them checked out.
Okay.
Yeah.
Now, tell me, how can Koala Care help these families with their, elderly family members who aren't drinking enough?
Well, we when we do our assessment, that's one of the questions we do ask. What are they like with their fluids? Are they taking in enough fluids during the day?
Yeah.
Are they eating properly? So we know to monitor that. And oftentimes we will plan that in the care plan itself, is to remind them on, hourly, every 2 hours, have a drink of water, sit down and we'll chat and we'll have a glass of soda water, that type of thing. So we often look for that. We often look for also when they do urinate, we also check to see if it's concentrated. A lot of times if it is, usually it doesn't smell very good, so that could be the start of a bladder infection. So that's really important, and of course we would notify the family about that. So that's all very important, but pushing fluids, getting them to drink, because honestly, sometimes they just totally don't. And if you can imagine someone with dementia who's lost their urge to be thirsty, it's even worse for them, because they really don't know that they're thirsty and that they need to drink some water.
Wow.
Yeah.
And that would just cause even more problems because they're not hydrated.
Yeah.
Now, Teresa, can you tell me what would a care plan have to include?
Our care plans include assessing their intake, food and water.
Okay.
So oftentimes that's when family members will say, no, they don't drink enough. We're really worried about that. They've been to the doctor a couple times with bladder infections. What can we do? So our plan would include something like reminding them on an hourly basis or every 2 hours to have a sit down and have something to drink, and monitor how much they drink, because that's really important too. And at the end of the day, you can say, well, maybe we need to give them some Jello. Jello's great because you use water to make it. It's gelatin. You can get the unsweetened kind. And it will also help them with their water intake as well. Also popsicles, sugar-free popsicles, that will also help them with their water intake as well. Any type of plan like that included. Protein shakes, that has water in it. Something tastes better than just water. they're more likely to drink it, right?
More likely.
Yeah, yeah.
Same with kids.
Yeah, exactly.
Kids are exactly the same.
Yeah.
They enjoy popsicles and they enjoy, you know, of course, juices and all that other
Of
stuff.
course,
It's not
yeah.
so good for you. But this is really interesting that you use the similar tactics with the elderly as you do with
Absolutely.
children to try and get water in
Yeah.
them. Teresa, do you see this as a one-time need or something that has to be done ongoing?
Well, it depends on the client and their family. If the client is very dehydrated and they need to drink a lot of fluids, you have to push more fluids more often. So once they get that resolved, though, it's a very good idea to maintain it. It still requires reminding them to have something to drink. So very important that, again, work with your physician, work with your nurse practitioner, whoever you may have monitoring the situation, and they'll guide you, they'll help you. We'll also do the same thing, and if we don't know the answer, we'll certainly find it out for them.
Right.
So yeah.
Okay. Now, are you limited to the hours of 9 to 5, or do you guys have extended hours? Like, how does that work?
Well, we are available 24/7, so we're available to the family anytime. And I always tell families when I do sit down with them that we are available 24/7. If they have questions, don't hesitate to call. There is one thing that is very concerning to families. People lose sleep over it. We don't want you to do that. Just give us a call. We'll talk you through it. We'll help you out as much as we can, and hopefully that'll take care of the situation.
So that leads me to my next question. How can somebody get started with Koala Care?
So just give us a call. Go to our website, koalacare.com/Edmonton-East, and you'll come to my site and you can give me a call. My phone number's there, and I will say it now, 780-328-6655. But if you go on the website, you can also write me an email and it'll come straight to my box where I'll contact you right away as soon as I see that email, and we can chat. But yeah, there's all kinds of ways to do it. Just call us.
So there's no ways that you can't get a hold of Teresa because they're 24/7. You can reach them on Google. Do a quick Google search for Teresa Craig, Koala Care, Fort Saskatchewan Home Care, and we'll be able to find them there.
Absolutely.
And you know what? Thank you so much for taking the time to take a look at this video.
Yeah.
Teresa is awesome. She is here, ready, willing, and able to help you with any kind of home care needs you might have for yourself or for a loved one. So please feel free to reach out and give us a call, and we'll see you guys on the next video.
Thanks so much.